So my name is Jared Keeley. I'm an assistant professor in the Department of Psychology at Mississippi State University. So to start, like I said, we're going to begin by talking about the purpose of a classification system. Okay? You'll see I've got 6 different purposes here. They're not mutually exclusive, nor are they exhaustive in any sense, but I think these are kind of a good way of organizing our thinking about the way these systems are supposed to work. The first purpose of classification system is for communication. Okay? Now, for those of you who might not know some of the history of this, prior to World War II, mental health in America was abysmal. It was just a chaotic state of affairs. Basically, every individual mental health professional at their asylum or their hospital each had their own system of organizing and naming the individual categories that they were working with. So if you, as a patient, showed up to one hospital, you'd get one diagnosis and one explanation about what that means. You would show up with the same problem somewhere else and get an entirely different name, an entirely different explanation for what your problem was. And so it was very confusing from a patient standpoint. It was even more confusing from a professional standpoint. So the individuals who were working in the mental health field had no way of talking to each other. If they were interested in investigating one particular kind of problem, somebody else might call it something entirely different, and they'd never know they were trying to talk about the same thing. Okay? So as the field progressed, honestly, the impetus for the first DSM was this chaotic state of affairs. The Department of the Census, of all people, actually approached psychiatry, and their organization at the time was sort of the precursor of the American Psychiatric Association, and said, we need a common naming system so that we can start to track how these disorders exist. Specifically, the reason the government was interested in it, they wanted to know how many people in the population had a mental disorder, and unfortunately the mental health field couldn't tell them. They had no idea. And so it was the impetus of the birth of the DSM system, was to be able to give a common nomenclature so that professionals could track these disorders across different settings, wherever they happen to be, as well as then communicate with each other. Okay? And you'll see that some of the changes in DSM-IV are aimed at this goal, being able to give a name to something so that professionals can talk about it.